Dr. Ayesha from Gynecology and Obstetric Department, Shaikh Zayed Hospital, Lahore, Pakistan. And I will talk about role of mass media in understanding about cervical cancer and its screening among married women. And my co-authors in this study were Dr. Amna Javed, Professor Muhammad Ikram, and Ruqayya Tariq. So, as we all know, that cervical cancer, besides being preventable and curable, unfortunately, 500,000 women would die of cervical cancer, and among them, 98% would die in developing countries like Pakistan, as predicted by WHO, and approximately 50 to 90% of the females were never screened, and this is the biggest dilemma. It is the third most common malignancy, and women over the globe with the 5,000 cases and mortality being 3,000 per year in Pakistan that could have been controlled efficiently through the prevention, but unfortunately, these measures remain inaccessible to the majority. So, the global policy was also made to expedite the eradication of the cervical cancer, and which has become a global problem, and 90 target of WHO was made in order to combat this issue to be met by 2030. Different studies surveyed the role of print and audio-visual media in improving the cervical cancer and screening awareness. Thus, mass media plays an integral part in increasing the awareness regarding screening as well as prevention of the cervical cancer, which includes the cervical screening, HPV vaccination, HPV testing, and further prevention. This study will highlight the awareness about cervical cancer and role of mass media in local population. So, the study aims to, number one, elaborate the understanding of married women as well as their source of information about cervical cancer and its screening, and also evaluate the advocacy of the married women through mass media in cervical cancer and its screening awareness. Some of the interesting facts we will we'll see in this study is the incidence of the cervical cancer is increasing worldwide. We can use the media to help creating awareness for its prevention and its screening. Cervical malignancy, being the preventable disease, can be caught in time by spreading awareness, just like the breast cancer. The study gives facts and figures of the developing countries, so the work must be done to limit the spread of preventable cancer. With the help of healthcare workers, print and digital media, respondents' knowledge on the cervical cancer and its screening may enhance as well as awareness on the health spectrum may be broadened. Let's talk about the methodology. The study was designed, the cross-sectional study was designed, and the questionnaire was pre-tested. The study was done in the outpatient department of gynecology and obstetric department of Shaikh Zayed Hospital, Lahore, from 1st of September to 31st of October. Convenient sampling technique was taken, and data was analyzed by SPSS version of 24. While talking about the results, 1,053 respondents were taken, which have failed the questionnaire, out of which only 17% perceived the positive role of mass media, while 83% had not found significance of media in spreading the awareness regarding cervical cancer screening and as well as its prevention. The results, including were these. Let's talk about first about the understanding about cervical cancer and screening among our population, which is 1,053 respondents. Only 13% have ever heard about cervical cancer. Only 11% knows about HPV, human papillomavirus, that is the main cause of cervical cancer. Only 9% knows that it is preventable cancer and can be prevented by primary and secondary screening and prevention. 6%, only 6% have ever undergone through the screening test. 4% ever gone through any awareness program related to the cervical cancer. 2% knows about it through awareness months. I hope that you are well aware about this awareness month, and it is January. Only 1% have ever heard about websites regarding CDC, Controller Disease Control, NHS, IRC for its awareness. If we talk about the source of information regarding cervical cancer and its screening, so the 11% of the people have gathered the information to the television. Only 12% gathered information to the newspaper. Internet gave the news about the cervical cancer in the screening about 19%. 22% of the people have their relatives and friends to be talked about cervical cancer. And 36% of the respondents have heard about cervical cancer and its screening from the doctor and healthcare workers. And hence, the doctors and the healthcare workers are the main source of providing the information regarding this cancer. Well, if we talk about the advocacy, that can media be helpful in preventing the cervical cancer and begetting the awareness of the cervical cancer? So the 68% of the people in the respondents said that the mass media can play a vital role in cervical cancer screening and its advocacy, while 32% had not found significant role of mass media in its awareness program. If we talk about which media is better, or which print media and or the audio visual media, or which one thing is better for its spreading the awareness, just like the breast cancer awareness. If I talk about the breast cancer awareness, it has been increased. Awareness has been increased from the 31% to 84% in our Pakistan for the last 10 years, just due to the campaigns issued by the government from the audiovisual media and from the telemedicine as well. So why not we talk about the cervical cancer awareness and its media and its screening to the media? 57% of the respondents had said that the audiovisual media is better than the print media for its awareness. 62% suggested that the billboards must be placed on the roadside for its awareness. 78% of the people said that a leaflet should be given by the healthcare facility whenever they visit for any problem to the gynae and obs outpatient department. So the healthcare workers must have informed them or either given the leaflets for them. 81% think that its promotion should be done like the breast cancer awareness campaigns. 87% suggested the government for the media campaigns for this preventable disease. 54% suggested and advocated that telemedicine can be the useful tool in the cervical cancer awareness, while 60% advocated that the screening program must be advertised to the mass media so that people may get awareness regarding this screening as well as prevention and HPV testing so that we can prevent the third most common malignancy. If we discuss about our results, the individual with the low levels of literacy sometimes do not understand a simple text and hence prefer the audiovisual media. And hence we see that the 57% respondents had advocated the audiovisual media as compared to the print media. These findings align with our results. This study also identifies that the leaflets and the billboards should be used because they deliver the motivational and educational information on cervical cancer screening. This study also revealed that the cervical cancer awareness campaigns should be arranged, and these findings were supported by the study conducted in Qatar. Furthermore, the study also suggests government to arrange the media campaigns on the cervical cancer as well as the vaccine, and their cost and the facility in the diagnosis of the disease must be at affordable prices. So these findings were found relevant with the Khan and his co-authors study, which was done in Pakistan. If I conclude my study, this study discovered the poor understanding towards the disease even in this modern era of the globalization. But with the help of healthcare personnel and advocacy through the mass media, we can disseminate significant and reliable information on risk factors, early detection, and screening that improves their health behaviors and increase access to the cervical cancer screening services. So this is need of an hour to create awareness through the mass media for this preventable disease and for this preventable cancer. Although there is a huge more work to be done, and although the world is doing the huge more work in the malignancy, the gynecological and reproductive malignancies, but in the developing countries like Pakistan, we need to work upon the awareness regarding its screening and the further source of the spread, so that we can inhibit the root cause of the root cause of spreading the cancer, or we can get the women more aware, because women empowerment is our main purpose. For any queries, you can contact us, or any questions are more than welcome. Some of the references included in my study were these. Any questions are welcome.